Animal Emergency goes behind the scenes at some of the most sophisticated veterinarian clinics in Singapore, revealing the dedicated work of these medical professionals as they save the lives of Singapore's cherished animals. It's no easy task for vets at the zoo when it comes to handling pregnancy tests for these giraffes.
Lucy, good girl, good girl.
And the SPCA goes to amazing lengths to try and save animals hovering between life and death. A special team from Japan will make history with the first ever open heart surgery in Singapore on a canine.
We are doing everything we can do to help this dog.
All this and more on tonight's Animal Emergency. A momentous event is taking place today. A Japanese heart specialist team, led by Dr. Masami, has been invited to the Animal Recovery Center to perform open heart surgery on a dog. A procedure that has never been carried out before in Singapore.
We were preparing to do open heart surgeries in the future ourselves. Masami is a world expert. We need a teacher. We need a leader.
Dr. Masami inspects the medical equipment installed specifically for this groundbreaking operation.
This is the new one for you. They came to check it yesterday. Everything's working. But once I set it, don't move it because the camera will be there. You can arrange to whatever configuration you're happy with.
This is Spot, a 12-year-old Jack Russell Terrier. 2 weeks ago, Spot was diagnosed with a heart condition after he started coughing up blood.
His heart will start to fail, he's not going to breathe very well, he's going to be very tired, It's not a good thing for him. He should be enjoying his life forever until the last day.
Spot has a blocked mitral valve and heart surgery is his only option. His owner, Michael, is bringing him in for the procedure today.
Okay, so it's on this afternoon.
Dr. Sabine, one of Animal Recovery Center's cardiovascular vets, discovered Spot's failing heart during an ultrasound.
So far, we had only medical treatment to offer, but medical treatment is not so good because dogs and cats suffering from heart disease are going definitely to die even with medical treatment.
Dr. Sabine knows too well, without surgery, this condition is almost incurable.
Because of the climate here, it's very hot. They suffer even more than in other countries from heart disease.
To give Spot a fighting chance, Dr. Sabine called Dr. Masami, one of only a handful of surgeons in the world who can perform heart surgery on small animals.
If this dog didn't have the surgery, it will be 6 months later or within a year, the dog will be more severe and maybe died. This is very delicate operation because the dog is small, the vessel is small too. It is difficult to maintain the blood volume and the blood pressure too.
The equipment used for the cardiopulmonary bypass is given a final check, and Spot is now ready for his operation.
We are doing everything we can do to help this dog.
Over at the SPCA HQ, an urgent call for animal rescue has just come in. Animal rescue officers receive the call and head to Serangoon Road to rescue a kitten that is reported to be covered in glue.
Okay, Glenn, you want to take the gloves? Where's the cat?
Upon arriving, the rescue team heads to the back of a restaurant. This kitten has caught itself in a web of glue that was meant to trap rats. If left unattended in this instance, the kitten will attempt to clean itself by licking the glue off. In doing so, it could be poisoned and even die. Back at the SPCA, the kitten is immediately taken to the resident vet.
Okay, we managed to find this cat.
Be easier.
Just swap
The rescuers waste no time and use oil to dissolve the glue.
Do one more time. Yeah, no.
But the substance is too thick and strong. Multiple treatments of oiling and shampooing are needed to finally strip the glue off the kitten. In the meantime, this fragile feline will be housed here until its next wash.
I think that's an interesting thing.
This one piece will make 52 layers.
Watch on mobile devices or the big screen. All for free. No subscription required. Download Veely now.
Another call has come in.
Amuki Avenue, block 416. So the cat is stuck in a ledge.
And the team once again heads off for another rescue. Will animal rescuers succeed in saving a cat from a precarious situation? And Dr. Masami prepares for Spot's landmark operation.
This surgery is not so easy. There is no guarantee for this operation.
We head to the zoo where Dr. Serena is anxious about a possible pregnancy.
Good girl.
Over at the Wildlife Animal Hospital, Dr. Serena is on an urgent assignment to check on Lucy, the giraffe. Lately, Lucy has been isolating herself, a behavior common in pregnant giraffes. The zookeepers suspect that Lucy might be pregnant. This could be great news for the zoo and its continuing efforts in the conservation of the animal kingdom. Upon arriving at the giraffe enclosure, Dr. Serena and her assistant move quietly as they prep the ultrasound equipment.
Lucy. Good girl.
Though giraffes appear gentle, they can react violently when agitated or threatened.
Lucy. Good girl.
She can't down because this is up.
The zookeepers are keeping Lucy calm while they wait for Dr. Serena to get ready.
Lucy. Lucy. Good girl.
Lucy endures her ultrasound check with some degree of discomfort.
Good girl.
Unfortunately, Lucy's ultrasound result brings disappointing news for Dr. Serena. Lucy is not pregnant.
Okay, no more, no more. Go, go, go. Great.
In spite of the false alarm this time, the team is still hoping to welcome a new calf to the zoo. Over at the rhinoceros enclosure with Jumina, another possible pregnancy is being investigated. Veterinary staff have to rely on regular blood tests to detect pregnancy in rhinos.
Alcohol to remove the debris and also to test vacuum.
Blood tests also help the staff to monitor any possible diseases.
Okay, we need to shake it to make sure the anticoagulant works on it.
These huge animals often mask their illnesses, so early detection is vital.
Go. Disha also, I release.
The procedure is over in no time. The team returns Jumina to her pen and is hopeful that the blood test will turn out positive. Back at Animal Recovery Center, cardiovascular surgeon Dr. Masami prepares himself for Spot's complex operation. This operation is so delicate that the camera crew isn't allowed to film the event up close. Vets from all over Singapore have taken time off to witness this groundbreaking surgery.
After anesthesia, we put the catheter in the artery and the vein and make the extracorporeal circulation and cardiopulmonary bypass.
Spot's life is now in Dr. Masami's expert hands. The surgeons watch intensely as the bypass machine takes over the function of Spot's heart and lungs.
We stop the heart, supported by the cardiopulmonary bypass, and then we cut the heart, repair the mitral valve.
The surgery comes with an extremely high risk factor. Spot can suffer a hemorrhage. Any excessive bleeding could trigger respiratory problems, and Spot's heart could completely fail.
But we support by the drugs, cardiotonic drugs, so we can help the dog heart and the circulation.
The procedure is nearing its end. The blocked mitral valve has been repaired. Dr. Masami will now stop the cardio support machine. He squeezes Spot's small heart carefully, hoping for it to restart.
Just on a normal ledge or?
Back with the SPCA team, the rescue officers arrive at Ang Mo Kio to save a cat stuck on a ledge. They scout the area to locate the cat.
Hi. Alright. Okay. Okay, Glenn, maybe you want to stand by the carrier?
Alright. The fellow crawling over here. Come into my side.
The rescuers approach with caution.
It's okay, it's okay.
The last thing they want to do is spook the cat.
Okay, Glenn, stand by the pet carrier.
Yep.
Glenn?
The team has just saved the cat from certain death.
Want to catch?
Okay.
Okay, the cat is safe, but it's just afraid. Okay.
Another successful rescue mission and another relieved cat. pleased to be back on level ground.
There's a dog at Yishun Avenue 1 hit by vehicles. It's unable to move.
The team is off once again. This time to Yishun, where a dog is involved in a hit and run. Have the rescuers done enough for their latest casualty? Or are the dog's injuries too severe? And will Spot survive his historic operation?
10% died, but it's a very severe cases.
Over at Yishun, the SPCA team follows up on a report of a dog that was a victim of a hit and run.
Hang on. Yes.
On first inspection, the dog is limping, but doesn't seem critically injured. But it is too early to tell. It certainly looks in need of help. The dog's injury seems more serious than it appeared. It needs surgery to save its hind leg. The SPCA is not equipped to deal with such a complicated procedure, but they will send the dog for a more thorough check at a veterinary hospital the following day. As the evening comes to a close, the rescue team heads off for a well-earned rest. And Angel, as she is now named, can be thankful for their efforts. Back at Animal Recovery Center, all eyes are on Spot as Dr. Masami deftly tries to jumpstart his heart. To everyone's relief, Spot's heart responds. Spot is cleaned up and brought to post-surgery care. What looks like a camping bag is actually an intensive care unit. Spot has woken up from his remarkable surgery. His vital organs are responding well. Dr. Masami and his team are elated with the outcome.
This surgery is done, and I feel as good and almost perfect. No bleeding and almost no regurgitation, and the blood pressure is well, and so I'm very happy.
Michael and his wife arrived to visit their beloved Spot.
So, everything okay for him?
I think so.
Yeah? Okay.
No, he will get very excited.
Oh, sleepy.
Spot will need close monitoring for another week or two. But for now, the happy couple is immensely grateful.
Spot will be getting recovered within a week, and then Spot will be better than before surgery.
The first ever open heart surgery on a dog in Singapore is a huge success.
We have so many patients waiting for this surgery. Owners treat their companion animals as a part of the family. If your child has a heart problem, you would want surgery for it. Otherwise, it's a sure death.